Good evening. I'm Suzanne Watley.
And I'm Gregory Zarian. Welcome to tonight's edition of Healthline.
Tonight we are speaking with an oral and maxillofacial surgeon. He practices here in Glendale. He has an office on West Broadway, is on staff at Glendale Adventist Medical Center, Dr. Armon Kotikian. Welcome.
Thank you. Thank you for having me.
Oral and maxillofacial surgery. That's a mouthful. Would you
It is.
It is. Good.
What that is?
Oral maxillofacial surgery is a specialty after dental school. We concentrate on the surgical aspects of the oral cavity, of course, and some facial surgery as well. In the clinical setting, we do a lot of extractions, for instance, especially wisdom teeth, where we actually put our patients to sleep. We do complex dental implant cases, treat patients with temporomandibular disorders, and excise and remove some small tumors in the clinical setting.
Doctor, I can't even what?
Temporomandibular disorder.
What does that mean?
Meaning a disorder or dysfunction
Thank
related
you.
to the temporomandibular joint,
Okay.
which is the hinge that connects the base of the skull to the lower jaw, meaning
Okay.
the mandible. So that's what temporomandibular means.
And what do you do in the operating room?
In the operating room, I usually do corrective jaw surgery. Patients who have an overbite or underbite or have a small chin, for instance, we can bring it forward or bring it back. Facial trauma, any facial trauma that the patient might sustain due to, say, an assault or motor vehicle accident or complex lacerations. Larger tumors in the upper and lower jaw that have to be removed, and some obstructive sleep apnea cases.
So, doctor, to know all of this, you had to do a lot of schooling.
Somewhat.
So somewhat. Real quickly, can you break down exactly what did you have to do?
Sure. After undergrad, I went to UCLA Dental School for 4 years and then continued to do a residency in hospital dentistry at the Long Beach VA, at which point I got interested in oral and maxillofacial surgery. So I applied and got in to the program in Michigan, did my medical school at Wayne State School of Medicine in Detroit, did 2 years of general surgery and my residency at the University of Michigan in Ann Arbor.
You look great for being 75. Okay, dental implants. Are you a candidate for it? Up next, we will find out if you are. Don't go away.
Hello, my name is Dr. Christine Armenian.
Hi, my name is Dr. Jack Bayramian, and I'm here to give you some helpful tips on you and your child's dental care.
My first tip for today is that we want parents to brush the child's gum line even before they get the first tooth. We don't want bacteria to build up, so we want them to use either a warm washcloth or a finger brush, and we want them to kind of brush their gum line to get all the bacteria off.
I think it's very important for the parents and the child to be part of the dental practice. The habits that these children will form at age 1 will help them carry through for the rest of their life.
My next tip for today is that about the age of 1, we'd like you to establish good oral hygiene habits. We'd like to brush every morning after breakfast and every night before bedtime. The last thing we want to touch a child's tooth before bedtime is a toothbrush and not their bottle or their sippy cup. My last tip for today is how to brush. This is my friend, Alex the Crocodile. He comes along with us through our checkups and exams and our screenings and helps us teach children how to brush their teeth. The first thing is that it's very important to use an age-appropriate toothbrush. The next thing is to make sure you're using a fluoridated toothpaste. A fluoride is a mineral that helps to mineralize teeth, and it helps to decrease cavities. We'd like you to start brushing in a circular motion with a 45-degree angle, and in a circular motion moving throughout from one side all the way along to the other side.
It's very important for the parents to be involved in the brushing and the flossing and the time of the day they need to brush and floss their teeth. It's important for the child to be able to brush and floss on their own, but it's really important for the parent to be there to monitor it and to make sure that it's being performed properly.
Welcome back to Healthline. I am Gregory Zarian along with Suzanne Watley, and you can catch us every Tuesday night from 7 to 7:30 right here on Charter Channel 380, and we're always on the web at glendaleadventist.com/Healthline, and we're always on our very own YouTube channel at GAMC Healthline.
Tonight we have the pleasure of talking about oral and maxillofacial surgery with Dr. Armon Kotikian. He practices here in Glendale. What's the most common reason that people might come to see you in your office?
In the office setting, usually it's for wisdom teeth. And most of them are like teenagers or in their early 20s that come in for wisdom teeth. Sometimes it's for dental implants. and sometimes it's for small tumors or for TMJ issues. But wisdom teeth and dental implants being the number 1 and number 2 on the list.
Wisdom teeth, how common are wisdom teeth?
Most patients have wisdom teeth. About 88% of us need them out.
Okay.
It's usually due to the lack of space. It's the number 1 cause. And what's happened through evolution is thousands of years ago, our jaws were much larger because we needed more teeth to chew on the raw foods because we didn't have fire back then to cook meals. So over time, things have changed and there hasn't been enough room, so the wisdom teeth get stuck, they get impacted.
Isn't that fascinating how we've evolved like monkeys?
Yeah.
Now, I had the pleasure of watching my wisdom teeth being extracted because I was fully awake. And the best part, of course, was when he got out the hammer and the chisel and
Right.
whacked away at it to
Right.
pull it out because the roots were a little twisted. But
Right.
do you usually put your patients to sleep with that procedure?
Not always. I always give them the option, but I tell them if they're fully impacted and it involves a lot of drilling, I recommend it. So I usually give them the option, but majority prefer to be sedated because they don't want to remember anything or hear anything. So
You do your own sedation?
I do. As an oral and maxillofacial surgeon, we're one of the only specialties where we can actually do our own procedure and our own sedation, meaning our anesthesia.
What is recovery like?
Recovery, most patients after a set of 4 wisdom teeth needs about 3 to 4 days. So usually if you do it on a Thursday or a Friday, most will go back Monday, if not Tuesday.
I'm holding my jaw. I don't know why. I mean, I've had my wisdom teeth taken out and they were impacted, but just the whole thing, I'm just going to sit like this. Go ahead.
Talk about tooth implants. People, if they have a tooth that dies, they have a choice of having it extracted, having a tooth implanted,
Correct.
or having like a bridge or some kind of little
Right.
device in there instead.
Right.
What do you recommend?
It matters, it's a case by case. If the patient's young and a lot of the teeth in the area are virgin teeth, meaning haven't had any crowns or any fillings, or if it's a good area, I highly recommend an implant because of the survival rate. The survival rate overall, the 5-year survival rate is about 95%, 85% for 15 years. So you get the cost-wise, it comes out to the same, say if you get a bridge or an implant, but you'll get a bigger return long-term as long as you take care of it and go in for your regular appointments.
So, doctor, when you say young, what age are you specifying in?
As far as
When you said the implants?
Implants, we have to make sure they've finished their growth before we put the implants in, because when the implant...
So when you say growth, what is an age?
Oh, for females, it's about 12 to 14, 14 to 16, for men about 16 to 18.
Okay.
After that.
Can you have an entire set of teeth implanted?
You can actually. If the patient's missing all their teeth in their upper and lower jaw, it can be done where multiple implants can be placed in the upper and lower jaw and can be restored with a full dentition.
But then is a lot of that done for cosmetic as well? Do people come in and just say, you know what, I want full implants cosmetically, outside of porcelain veneers and lumineers and all that stuff?
Right. It's not just cosmetics, it's actually chewing efficiency. When patients have a full set of dentures, their chewing efficiency drops to 25%.
Interesting.
So by going back and having the implants placed, your efficiency improves. It actually helps with speech as well. It's not something they have to remove at night.
Doctor, is there a proper way to chew? And I know that's such a random question, but when you were saying chewing deficiency, is there?
No, what I meant was that when the patients have dentures, the chewing efficiency drops to 25%, meaning because they don't have their real teeth.
Got it.
That's why.
And just briefly, can you explain what an implant involves?
Sure. If the patient's lost a tooth, had a tooth extracted, and the area is appropriate for an implant, so usually when a patient comes in, we have to evaluate the patient to make sure there's adequate bone and adequate tissue for the area. If there isn't, then the patient might require some bone grafting because you have to have a certain amount of bone for certain areas in the mouth, and it's a case by case. So if the patient has an appropriate room for the implant can be placed, usually following the consultation appointment, then we usually allow it to heal for about 4 to 6 months. 3 to 4 months in the lower jaw, about 6 months in the upper jaw before it's restored by the crown, before the general dentist restores the crown, which is the top portion.
Thank you, doctor. So do you grind your teeth or do you pop your jaw? Up next, we will discuss all of that.
I am a swimmer. I am a dancer. I am a mother. I couldn't be me without the Spine Institute at Glendale Adventist.
Their renowned specialists provide everything from physical therapy to advanced surgical techniques for your neck and back pain. Glendale Adventist Medical Center, helping you get back to life.
Back here on Healthline with Dr. Armand Kotikian, a surgeon who specializes in oral and maxillofacial surgery here in Glendale. Doctor, talk about what happens when the jaw pops when you're talking or eating. What does that indicate?
Sure. When the jaw pops, it usually indicates the disc that's in between the base of the skull and the lower jaw, meaning the mandible, pops forward and pops back. It's actually common in 30% of the population. More common in females. I think it's possibly related, it's hormone related. So the ligaments tend to be a little bit more lax, so it pops a little bit more. But most patients don't require any intervention. It's usually a very conservative treatment that we do for these patients.
So a real simple jaw pop and you're on your way. As I said earlier, what about grinding of the teeth? What do you prescribe for that?
So for the grinding of the teeth, we try to find if there's an etiology behind that, meaning a cause, if there's a new stressor in the patient's life. So I usually ask them questions, has something happened recently to your life or your family? A lot of times that actually can tell us if there's a new stressor in life. If there is, then we actually will get them involved with a family therapist, see if they can help them. If not, then we'll actually pursue another avenue, which will be placing them on a soft diet and avoid chewing gum or chewing their nails to avoid putting stress on the joint itself.
Got it.
I hear people say, I have TMJ.
Right.
What does that mean?
Well, a lot of people say, I have TMJ. The TMJ is an actual anatomic area, meaning the temporomandibular joint. The correct terminology is temporomandibular dysfunction, meaning TMD.
Okay, so they really have TMD.
TMD, exactly.
And what is that?
It means temporomandibular dysfunction, a dysfunction within the joint, between the mandible, the lower jaw, and the temporal bone.
Is that arthritis, or what causes it?
What causes it? A lot of times, what's called a parafunctional habit, meaning bruxism, patients who grind their teeth, that can cause the pain. The majority of the time when patients have pain, it's not over the joint, it's actually muscular. So it's actually the muscles get fatigued and it causes pain. Just like if you were going to go out for a run and you hadn't exercised for a while, you get the muscle cramping. Same thing.
Is there prevention for that?
Usually having them cut back on some of the habits that they might have, such as chewing gum, as I said, or chewing on their nails. If that doesn't work, then we work our way into muscle relaxants, if it's truly muscular in etiology.
Interesting.
And what are some of the common problems that you deal with in your practice here in Glendale?
One of the biggest things I see from the medical side is diabetes. It's very, very common in the community here, and that's usually associated with obesity in this area. Another thing that I see a lot of is smoking. So it's very, very common.
We're a very strong Armenian community here.
Correct.
A lot of Armenians love to smoke.
Right.
A lot of Armenians probably end up in your office and they are old school. How do you say enough?
Sometimes it's very tough, but what I usually do is I scare them if I can, to tell them, this is what will happen. Smoking doesn't just affect the oral cavity or just the lungs. It could also increase the risk of getting bladder cancer, pancreatic cancer. Then if I have to, sometimes I will show them cases.
So then scaring them straight per se, does it work? Or do you find, because women, from my experience, may acquiesce to what you're saying. Men are a little more staunch and...
Exactly.
So what guys, this is all for you, Armenian men, I hope you're listening. How do you scare them into finally taking care of their lives and quitting smoking?
I give them examples.
Okay.
I've mentioned, for instance, people who are in the public, meaning movie stars. I bring that up if I can. As I said, I show them pictures sometimes. Show them this is what will happen to you.
So most recently we had Michael Douglas. Eddie Van Halen, who had tongue cancer. And then we were discussing Roger Ebert, the critic.
Right.
Salivary gland cancer.
Correct. His was His was a salivary gland tumor, whereas Michael Douglas's was throat cancer, and he was treated with chemo and radiation. But unfortunately, his is a stage 4. As we know, as the stages increase, the prognosis goes down, but time will tell.
How common is oral cancer?
Oral cancer makes up 3% of all oral cancers in the United States, meaning there are 30,000 new cases diagnosed each year in the United States. 1 American dies every hour in the United States due to oral cancer.
Because I've personally lost a friend to it. So when he said that the treatment and everything was intensely insane for him. He's never experienced anything.
And you can end up with whole parts of your face or jaw having to be removed?
Correct. And undergo radiation and possible chemotherapy, which have their side effects as well.
So then, and all of this doesn't always scare the patient?
Not always, especially men. That's the problem I usually have. I think it's a little bit easier with females, especially given that most of them are mothers. But with men, I think it's a little bit more difficult.
Do we find oral cancers with other causes in various pockets of our ethnic communities here?
Usually smoking is the #1 cause, but another one in Indians, meaning Indians from India and Pakistanis, they chew on something called the betel nut quid, which is a nut which they wrap with a leaf and put some lime in there, and that actually can cause oral cancer as well. In India itself, oral cancer is the #1. Is #1 in men and #3 in females.
Wow.
You know, there's something that you or your bedmate might be doing that is more than simply annoying. When we come back, solutions for snoring.
Here I am at the Kids Dental Place on Pacific in Glendale, where Dr. Christine Armenian and her staff share with parents and children how to properly take care of their teeth and make it an enjoyable experience. Why is it so important for children to start getting their teeth checked at such an early age?
Dental cavities is the #1 most common chronic disease in children nowadays. It's 5 times more than asthma. 4-year-olds nowadays, within the 4-year-old population, 67% of them have cavities. 51 million school hours are lost due to dental concerns. So if these children end up with such bad dental concerns, then if it's not addressed, they usually end up as adults who have really bad teeth.
So doctor, please take me through the experience of a brand new patient.
Absolutely. Our biggest promise to what we do is to make sure it's absolutely a pleasurable experience. So when a child comes in, the first thing we do is we greet them with a big smile. We count their little princess teeth or their superhero teeth.
So you give them names?
Absolutely.
Okay.
We got Princess Belle there, we got Spider-Man there. We get to count them. We have the parents sit in the chair, we actually count their teeth, and then we have the 2-year-old sit on the parent's lap, and with the parent, we count the child's teeth.
Because if mom and dad do it,
Absolutely.
then the child feels a lot safer to do it. What age does it start? What age do you encourage family members to start getting their teeth checked?
We love to see them at 1-year-old, because at age 1, a child doesn't have cavities. They come in solely for us to introduce them to our dental home, to develop a dental home.
So doctor, from the get-go, you invite the young patient to become a part of the process.
Absolutely.
It was such a pleasure. Am I too old to come here and see my little superhero teeth?
Anytime, Greg.
Okay, perfect.
Definitely.
So, show, tell, and do. That is the promise and the purpose from Dr. Christine Armenian and everyone here at the Kids Dental Place. Now, if you want to find out if you have perfect princess teeth or super strong superhero teeth, come join us and you will be sure to find out. Welcome back. Okay, for those of you that snore, we are here to save your life because you've been laying next to somebody that has not been able to sleep because of your constantly. Dr. Armand Kotikian, what causes snoring?
Very good question. So there's actually two, it's broken down into two. There's a central and an obstructive. Central meaning the cause can be from the brainstem, meaning if the patient has a tumor in the brainstem or might have multiple sclerosis, meaning the effort is not there. Whereas the second type, which is the most common, is obstructive, meaning there's an obstruction in the airway, meaning it could be the nose, it can be the soft palate, which is the portion of the back of the upper jaw, it could be the base of the tongue, it could be the tonsils, or it can be the back of the airway as well. So it can be a combination.
How common is snoring?
In obese patients, it's very common, and I occasionally see it in kids as well. But as patients get more obese, you see it more and more.
So that's just an easy, basically, you're basically saying for those of you that are obese, a great way to quit snoring is just start a brand new healthy lifestyle.
Definitely. We always want to do the non-surgical options, meaning weight loss, putting them on a nice diet, referring them back to a primary care physician or a nutritionist to put them on a good diet plan.
So that's one way to save lives?
Definitely.
Okay, so we gave you one, I promised. Okay.
So with this obstructive type, it's like the tongue falling back into the back of the throat. And what causes the snore, though? What's the vibration coming from?
It's the effort that we're trying to take a breath. So it vibrates between the back of the airway and the base of the tongue, or whatever might be the obstruction. It's actually the vibration.
Can it cut off your breath?
It could, actually. And when patients are sent for a sleep study, they actually will monitor that. And there's a calculation they do to figure out how many times you actually stop breathing. Correct.
And the Glendale Adventist Medical Center has a sleep center that I've
Yes.
had the pleasure of visiting, and we've also featured on the Healthline program. It's very interesting. You go there and you bring your teddy bear and lie in the bed,
Right.
sleep all night, and they videotape you, and
Right.
they watch all your vital signs on a
Correct.
monitor and see how many times a night you stop breathing.
Correct. That's one of the things they look at. They also look at to see if you have any abnormal rhythms of the heart, which obstructive sleep apnea can cause. They also look at your muscular movements, look at your eye movements. So several things they look at actually.
What are some non-surgical treatments?
Non-surgical, again, it goes back to weight loss. The diet is number one. Some patients start off with the CPAP, meaning continuous positive airway mask that they wear during the night to keep their airway open. Then there's something else called a BiPAP as well. Some patients, if they're mild or moderate, and it's broken down to 3 categories, mild, moderate, and severe, can qualify for an oral appliance, which will actually bring their lower jaw forward when they go to bed, preventing that obstruction.
Do the nose strips work, doctor?
In some patients, if it's truly nasal.
When do you feel it necessary to have to operate?
If all non-surgical options have failed and the patients have tried everything that's available out there, is when we prefer to do the surgeries. But we always want to prepare the patient and to let them know this is a surgery, so there are complications associated. So I always want to make sure they're fully aware of all the complications.
Now, what about kids and snoring? What are
Correct.
options with that? Same thing?
With kids, a lot of times, again, since obesity is on rise, obesity is on the rise. That is one of the causes. Tonsils are the number 1 cause actually in kids, and enlarged tonsils, which in some patients will involute after age 9 or so. But tonsils are number 1 cause.
Well, what does that mean, doctor? Involute?
Meaning get smaller
Okay.
over time. I apologize. So that's one of the. We always want to find out if we can do the non-surgical options before we refer them to any surgeon for the removal of tonsils.
Thank you, doctor. Okay, we have a couple more questions that we like to call Healthline Rapid Fire. True or false? Sleep apnea is connected to ADHD.
True. In certain kids, due to the tonsils, it can be associated with ADHD.
So with the removal of tonsils, does it go away then?
I've had a few cases just this past year, which when I referred them over, patients did have ADHD, and it actually resolved.
Great.
If you sleep alone and nobody hears you snore, how would you know the symptoms of sleep apnea?
Some of the common symptoms are being tired during the day, being moody and very irritable. Some patients might have actually bedwetting at night. So those are some common signs.
Age with the bedwetting.
A little bit more common in kids than adults.
Everyone grinds their teeth. True or false?
False.
Oh, so they don't?
No, not everyone does. A lot of times the patients that grind usually have some kind of a new stressor in their life, which might be causing that.
Next question. Nothing can be done about a protruding chin or a receding chin.
False. False. That can be corrected with corrective jaw surgery.
Great. Okay, doctor, true or false? With implants, does the bone deteriorate?
After an implant's placed, you get very minimal bone loss, actually. You will get a little bit initially due to the inflammation, but for the most part, most of it will stay put.
Okay, then what about dentures?
When dentures are in place, you will get more resorption because there's no actual loading, meaning there's nothing in the bone. It's a stressor from the top that's causing the resorption.
Okay.
Up next here on Healthline, the best ways to avoid a trip to the oral maxillofacial surgeon.
At Glendale Adventist Medical Center, our heart specialists understand you have questions about the health of your heart.
At Glendale Adventist, they fixed my daddy's heart.
At Glendale Adventist, they fixed my heart.
We offer the latest cardiac services and technologies. Do you know your heart health? We are Glendale Adventist Medical Center, healthcare at a higher level.
We've been getting some great information from Dr. Armand Kotikian, oral and maxillofacial surgeon here in Glendale. And with all due respect to your expertise and your education and everything that you do for people here in the Glendale community,
Right.
How can we avoid having to see you?
Good question. Number 1 is seeing your general dentist on a regular basis. Make sure you see him or her a few times a year just to make sure you don't develop any big cavities, so it won't require my services. Another one is stop smoking. As we know, that's the #1 cause of oral cancer here in the United States.
But also in this community as well.
In this community especially.
In this community.
Exactly. Another thing is wear your seatbelt and wear appropriate facial gear so you won't sustain any facial injuries. Given that summer's coming now, we tend to see a little bit more and more facial injuries. Another thing is if you can, lose weight. Diet and exercise to decrease the chance of developing obstructive sleep apnea.
Doctor, how quickly do people respond to you saying lose weight?
Certain patients, again, I think it's a little bit, with females, I think it's a little easier.
Because especially in this community too as well, the pastries and the treats and everything that we have to offer.
I know, there's so much out here, but it's sometimes tough. Again, it comes back to telling them, what can happen with obstructive sleep apnea, scaring them that you can get a heart attack and die middle of the night. You might not even be aware of it. So, and how it can cause abnormal cardiac rhythms, which can lead to other problems down the line. So I try to educate them what can happen if it continues.
All the while being preventative.
Exactly.
You have a trip to Armenia planned. Tell us about it.
Very exciting.
In July, I'm actually going to the Armenian Medical International Congress, which is set up every 2 years, and this year it's actually in Yerevan. And I have submitted 2 topics to lecture on. And after the lectures, which will take place from the 7th through the 9th, as a group, we're going to be traveling to Qarabakh to offer free surgery in Shushi and possibly Stepanakert.
I've been there, so
have you?
I'm smiling. Yes, I've been there. I get it.
What kind of work would you be doing there?
Anything related to my field. Right now, the health minister has informed us that they've already started the screening process. So it's mostly going to be a lot of tumors and possibly cleft patients as well.
Cleft palate?
Cleft palate, cleft lip, and palate. Correct.
Doctor, thanks so much for sharing your expertise and also inviting everyone to have proper oral hygiene, lose weight, lead a healthy lifestyle. Doctor, for people to find you, how can they find you?
The best way to get in touch is to call our clinic at 818-409-0925.
Thank you.
Thank you.
Thank you for joining us. We hope, as always, that you took something away to lead a stronger, healthier life. I am Gregory Zarian, along with my wonderful co-host, Suzanne Watley. And remember, the most important thing you have is your health. Have a great night.
Good night.